Proper hydration is essential for your body to function at its best. Fluid helps preserve and provide nutrients to the brain, kidney, liver, and the heart. While adequate hydration comes with no signs or symptoms, you can likely assume you are hydrated if things are functioning properly and you feel well on a consistent basis. How can you tell if you or someone you care about is becoming dehydrated? That's exactly what we are going to discuss in this video. Here are the 9 signs of dehydration to watch out for. Number 1 is muscle cramps, weakness, or pain. Our muscles require plenty of water and electrolytes to properly function. Without enough fluid, our muscles can become extremely sensitive and spasm or contract involuntarily. We need water to flush our bodies of cellular waste, as buildup of toxin can lead to inflammation, which often results in pain. Muscle cramps can happen while you are exercising, or you may wake up in the middle of the night with cramping in your calf muscles. Also, loss of electrolytes such as sodium and potassium can lead to cramping. Reach for electrolyte-filled sports drink or coconut water next time you feel a muscle cramp coming on after exercising. Number 2 is dark-colored urine or no longer urinating. An easy way to test and see if you are dehydrated is by checking the color of your urine. Normal urine should be pale yellow like lemonade. If your urine is a darker color like apple juice, this could be a sign of moderate to severe dehydration. If you find your urine is dark yellow, start drinking more water immediately. It's best to take small sips of water for your body to adequately absorb. If you are not urinating at all, you are most likely severely dehydrated. This requires immediate medical attention. If you feel you're not getting enough fluids regularly, consider taking a large water bottle with you to drink throughout the day. Number 3 is dizziness or fainting. Although dizziness can be a symptom of many different conditions, it is a classic sign of dehydration. When you are dehydrated, you don't have enough fluid in your blood vessels. You feel dizzy because you're not getting as much blood flow to the brain. You are most likely to feel dizzy when you sit up from lying down or standing up from a sitting position. If the blood flow to your brain drops significantly, you may notice a darkness in front of your eyes, which may be a sign you're about to pass out from dehydration. Number 4 is dry skin. Thinking that people who get dehydrated are really sweaty is a misconception. In fact, as you go through various stages of dehydration, your skin gets very dry. Dehydration causes skin to be dry and look sunken in some areas, such as under your eyes. Your skin will also have less elasticity than normal. If you're caring for someone who is frail, one way to tell if they are getting dehydrated is to gently pinch or press the skin on their arm. The skin should spring back to its normal position in less than a couple seconds. If skin remains tented after being pinched and takes some time to return to its normal flat appearance, they might be dehydrated. Number 5 is bad breath and dry mouth. Dehydration can prevent your body from making enough saliva, which has antibacterial properties. Without enough saliva, you can get bacterial overgrowth in the mouth, which causes bad breath. It's the same reason you may wake up with morning breath. Saliva production slows down during sleep, leading to unpleasant taste in the mouth as bacteria grow. So, next time your mouth seems dry and your breath smells less than fresh, it may be time to rehydrate. A glass of water may provide instant relief for a dry mouth and throat, but consistent hydration helps ensure that the mouth always produces enough saliva. Number 6 is food cravings, especially for sweets. Sweets cravings may mean that you are thirsty. The liver uses water to release stored glucose, so you can actually get cravings for food when you become dehydrated. While you can crave anything from chocolate to salty snacks, cravings for sweets are more common because your body may experience difficulty breaking down glycogen to release glucose to use as fuel. Number 7 is headache, fatigue, or confusion. When our bodies are dehydrated, they experience a decrease in blood volume, which can cause headache, tiredness, and weakness. Dehydration headaches can be mild or severe. They can be felt in one specific area of the head or all over, and they usually get worse with movement. Also, dehydration has been reported as a migraine trigger. Although various factors besides dehydration can cause headache, drinking a full glass of water and continuing to sip on more fluids during the day is an easy way to ease your pain if dehydration is the cause of your headache. Also, dehydration can make you feel a little less sharp than usual. If you are a caregiver for someone who seems confused, don't rule out dehydration as a cause. A lot of things can cause confusion. Maybe mom or dad has an infection, but it could also be that they are getting dehydrated and their blood pressure has dropped. And it's amazing what can happen if you give them fluids. Number 8 is irritability. You may get cranky when you're experiencing substantial dehydration. This is particularly important warning sign for children, as they may have a more difficult time understanding when they are suffering from dehydration symptoms than adults. Children who have lost between 3 and 10% of their body weight in fluid will exhibit the symptoms of mild dehydration and may be fussy, irritable, and tired. Number 9 is dust. Dust is the main way your body alerts you of dehydration. However, relying on feelings of thirst alone is not an effective way to manage hydration. Your thirst mechanism lags behind your actual level of hydration. So by the time you feel thirsty, you are already dehydrated. Your sensation of thirst diminishes with age, making it an unreliable indicator of dehydration for many older adults. Dehydration occurs when you're not getting enough fluids, whether it's from exercising, hot weather, or illness. Dehydration can quickly become dangerous, no matter the cause. You can help prevent dehydration by drinking plenty of water throughout the day and taking fluids with electrolytes if you start seeing early signs of fluid loss. When it comes to water intake, you've probably heard that every day you should consume 6 to 8 glasses of water, or half your body weight in ounces, or at least 2 liters. These rules of thumb aren't bad or wrong, but they are just that, guidelines. There is no set amount for every single body. What keeps you hydrated may not be enough for me. Thank you for watching. If you liked the video, please share with your friends, and please subscribe to the channel if you haven't already done so. If you want to be notified of our new uploads, click on the bell icon to turn on all your notifications. Until next time, stay healthy, and remember, health is the greatest wealth.